Good day, everyone. Today we are going to look at the anatomical structures such as vertebral column, the ligaments and muscles around, as they appear on different images such as radiographs, CT images, MRI images. To set our goals clear from the beginning, we are not discussing the techniques which we use in the radiology department, but our goal is to differentiate and to be able to recognize the basic anatomical structures, how they appear from the different angles. Which angles I mean? Of course I mean the anatomical planes, because all our images, they are usually taken in three basic anatomical planes. The coronal plane, which is this one when the computer cuts the body from anterior to posterior direction, and we can scroll through them and evaluate pathologies. And the second plane is the sagittal plane, and in this case the computer goes from the right side to the left side, taking images. Finally, we'll look at the axial view, which is probably the basic. This is the images which are taken in the transverse anatomical plane, and as we scroll down, you can see we have some bone here all the way around. This is our skull. Going a little bit ahead, I want to give you some useful tips how to differentiate the CT scan from the MRI scan in a few seconds without thinking a lot. You just need to look at the bones. The CT scan is using X-rays as well as radiographs. That's why bones are already opaque in this method, and they always appear white on images. And just to compare with, let's look at the bones, how they are here on this MRI. This is the T1 and T2 sequences of MRI, and you immediately can see the bones are grayish in color. That is because we use the proton density. This technique, it allows us to evaluate different layers of soft tissues. The fatty tissues, they appear bright on T1 sequences, but something different appears white on T2 weighted images. And have a look at the fluids, the liquids, the edema, the traumas, the bleeds, they appear bright on T2 weighted images, while the fat and other soft tissues are not so bright. And it allows the traumatologist to find the pathology, the edema, the bleed very quickly on the T2 weighted images, while anatomy mostly uses T1 images to evaluate the relations between the organs, the shapes of the organs and structures. So for anatomy, T1 is more useful, but for pathology, T2 is considered to be useful. So this is in fact the basic difference between the T1 and T2 sequences on the MRI. So have a look how smart we are already. We can differentiate not only CT from MRI, but also T1 and T2 sequences of MRI in just few seconds after beginning of our lesson. So you're gonna be much smarter at the end of this course. One more important feature in interpretation of computerized images: when we look at them from the bottom up. That's why right and left sides, they appear on the opposite sides. For example, this is the liver, and it seems like it is on the left side, but if you are standing below this line and are looking up, then it is on the right side, how it must be. So this is the fact which we need to keep in mind. Then we look at the CT and MRI images. Well, what I am going to do now, I'm going to scroll down and to point your attention to the structures which we have in the neck. We are not looking at the head right now, so I'm just scrolling it down. But right here in the very lower part, in the outlet of the skull, you can see where I am according to this blue line on my left. This blue line, it shows us the level where we are. And we also can change the different windows. We can use the contrast, without contrast mode, and bone window, which is right here. So I'm in the bone window. And these whitish tissues here, which you see, they belong to the occipital bone with a big foramen in the middle, which is the foramen magnum. On both sides of the foramen magnum, you can see two oval-shaped structures. They are condyles. And condyles, as you know, they articulate with the lateral masses of the atlas. So the next bone which appears just below here is the anterior arch of the atlas. Well, let's go further downward, and you can see another bone which is just here in the middle, and this is the dens of the axis, the second cervical vertebra. You can see a tiny grayish lines of articulation between the dens and anterior arch of the atlas, the atlantoaxial articulation, the medial one, and tiny grayish lines between the condyles of the occipital bone and the lateral masses right here, the atlanto-occipital articulation. So these grayish lines, they show us how stable the craniocervical articulation is. If you see they're wider than 2.5 millimeters in adults and wider than 5 millimeters in children, you should consider it as abnormal. Okay, let's scroll down, and as we scroll down, the full shape of our atlas appears. You now can see the lateral masses with the foramina transversaria on both sides and the posterior arch of the atlas. Now let me switch to the sagittal MRI image. The bodies of our vertebra are all located anteriorly here, and the bony processes which are just behind are the spinous processes, of course. We have some space between them, between the arches and bodies. This is the vertebral canal. The spinal cord is running down through it, and we have some dark lines just in front and behind them, the bodies of the vertebra. Here, and they are the anterior and posterior longitudinal ligaments, as well as the ligamentum flavum just behind here, the intraspinous ligaments between the spinous processes, and the supraspinous ligament, which is running up posteriorly here and becomes the nuchal ligament, as you remember, in the cervical region. What are these particular spaces between the vertebrae? How do you think what they are? The other IV discs, the intervertebral discs. And we usually look how symmetrical, how identical they are from up down. And the whitish center of the interventricular disc tells us that the disc is healthy. The nucleus pulposus is in the center, so it works as a spring, allowing us to move our bodies. Well, let's now try to scroll laterally, and I want to show you one more feature which we must be aware of. This feature is right here. Have a look at these joints which appear on the lateral side of the vertebral column. These lines right here, these 1, 2, 3, 4 lines, they represent the articulations between the superior articular processes and inferior articular processes of the spine. The right name is, the full name is zygapophyseal joints, but we commonly shorten it into the Z joints or facet joints. The facet joints are the common source of chronic pain in the different regions of the vertebral column, so we need to look at them and compare the ones on the right with the ones on the left side. The axial image show us the anatomy of the vertebrae, and again you see the bodies are in front, the vertebral arches are behind. The cerebrospinal fluid inside is bright, so we're dealing with T2 MRI with the grayish substance in the middle, which is the spinal cord, And you see in some areas, as I scroll up and down, the pedicles which are right here, they kind of disappear and they open the space. This space on both sides is the intervertebral space, which allows the passage for the spinal nerves. Of course, this distance between the body and arch here is important to evaluate, as it allows us to understand is there enough space for the spinal nerve to pass or not. The main features of the thoracic region are ribs, of course, and as I scroll down here you can see how these bones come on right and left and articulate with the bodies and transverse processes in 2 points. Here and here, the heads with the bodies and the costal tubercles with the transverse processes. And you can see the body shape and the shape of the vertebral canal are changed. The transverse processes, they have no more foraminal transverse area. And the spinous process is long and slender here. By the way, as you use this program in our lab, you easily can select any structures you are interested in, for example the bones, and scroll down, checking where one or another bone goes, so you can just highlight the veins for instance, and remove the bones to make the picture clear. And again you can go down and upward and check how one or another vessel appear on the image, how it looks like. Or another example, you can highlight the muscles, for example, have we them here, or arteries, or even alimentary system. Let's remove the arteries, the alimentary system is easier. And just scroll up and down and look. Okay, so we are approaching the lumbar region now. Let's go away and look what we have. This is our last 12 vertebra. How do I know that? I see the ribs and beautiful costodiaphragmatic recess on both sides. This is our last T12 vertebra. And I see the dramatic change in direction of zygapophyseal joints. Now they are more vertical. That reduce their mobility but increases the stability, and we need stability in this region because the weight of our body, it eventually comes to the lumbar vertebra. Well, what else is changed here? The shape of the body, the shape of the spinal canal, vertebral canal. We have the bodies disappear on some levels. Is it normal or pathological? Of course it is normal. That means we are at the level of the intervertebral disc. And the spaces which we have here on both sides, they are kind of important. They are our intervertebral foramina for the spinal nerves. How can you understand which level you are at and which exactly a vertebra is one or another? It's easy looking at this image here. On my left upper angle, you see the sacrum just below 5 fused vertebra with the coccyx attached. And the first IV disc is the one which belongs to L5. So we call the vertebra above as L5 and the disc below it, it belongs to it. It's the IV L5. The next one is L4 and the vertebra is L4, 2, L3, L2, L1. So I'm now at the level of L2 body vertebra. The same numeration is for the intervertebral foramina between the vertebrae. Then each intervertebral foramina below the vertebra has the same number as the vertebra above, and accordingly the spinal nerve which leaves this space, it also has the same numeration. So we are now at the level L2. So as I scroll down here, I can tell that the nerve which passes here is L2 as well, and this IV disc which is just in front of the vertebra right now, this is the second lumbar intervertebral disc. Let's look at the MRI now, as it allows us to see all the structures much clearly. The muscles behind, you see the beautiful erector spina, the bodies of the vertebra, the perfect foramina here, and the other intervertebral foramina with the contents. The contents are nerves, of course, the beautiful IV discs, which are quite healthy. So I would say this vertebra belongs to a young person. And as I go further toward the midline, right here, I can see the beautiful vertebral canal with the spinal cord inside, the ligamentum flavum behind, which is kind of whitish. Let's try to change the contrast to T2, and now the cerebrospinal fluid is already opaque, it is bright, and you even can see the conus medullaris right here. Can you tell me at which lumbar level it is? Yeah, you're right, it is quite high on this image. It is at the level 81, and everything which is below here is the cauda equina. And as I scroll more laterally, you can see how the nerves of the cauda equina, how they run laterally and downward, trying to reach the corresponding intervertebral foramina. By the way, the distance between the posterior surface of the vertebral body and the vertebral arch is quite important, as it shows us is there enough space for the cauda equina and for the conus medullaris or not. It normally must be 15 to 20 millimeters. This is the normal parameters, but if it is narrower, like 13, 11 millimeters, we can consider the diagnosis, the lumbar spinal stenosis. Especially beautifully the cauda equina appears on the axial images. And now I'm at the level T12, and you see the conus medullaris in the middle of the bright central canal. So we are dealing with T2 MRI. And as I go further down, you will see a bundle of dark dots inside. So this is our cauda equina. And as pedicles disappear, that means we are at the level of the intervertebral foramina. You can see a nerve which exits this foramen right here. This is the nerve number L1, because I'm at the level L1. And the next nerve, which is the closest one inside of the vertebral canal, this one is the traversing nerve L2, and it's gonna leave the canal at the next intervertebral foramina right here. So one by one, these nerves, they leave. This is the L2 spinal nerve right here. So the size of intervertebral foramina is important. It must provide enough space for our spinal nerves to allow them exit the spinal canal. And you see some other dots inside of the intervertebral foramina, right? These dots are arteries and veins, the medullary arteries and veins which supply the spinal cord itself. Of course, you understand if the intervertebral disc is damaged, if it is destroyed with age, like in old people, usually they degenerate, or if some herniation of the nucleus pulposus happen. In that case, the space between two adjacent vertebrae become narrower, and accordingly the diameter of the intervertebral foramen also becomes smaller. That can squeeze the nerve inside and provide the chronic back pain and such conditions like sciatica. Especially the L5 intervertebral foramen is vulnerable to injury. You can see it is a little bit narrower from the beginning, and the vertebral bodies, they change the angle here. So the L5 intervertebral disc is the one most commonly suffering the largest pressure and commonly herniated. So this intervertebral space and IV disc, the L5, they are vulnerable to damage. Okay, thank you for your attention. I think it's more than enough for the first lesson. I'm gonna see you later with our next topics. Good luck with your studies.